Okay, so unfortunately, I have to start because I have a surgery after this. So good afternoon, everyone. Thank you for the invitation to our esteemed organizers of this event. Thank you for giving me the opportunity to share a topic that I am extremely passionate about. I am Dr. Otorhinolaryngology from the medical makerspace at Zamboanga City Medical Center, and I will be talking about 3D printing in otorhinolaryngology. Two disclaimers before I start. First is that I am still a resident in training under the Department of Ears, Nose, Throat, Head and Neck Surgery. I am by no means an expert in 3D printing. I just happen to be a doctor who is a maker. Second is that my presentation contains a few graphic images which may be disturbing to some. Our medical makerspace is headed by yours truly and two others, Dr. Sullivan and Dr. Cortez. We are directly under our hospital, the Zamboanga City Medical Center, and work closely with Fab Lab Mindanao. This relationship has bloomed into something worthwhile as we have started training doctors in the use of 3D printing for the creation of anatomical models and surgical planning guides. So 3D printing was first invented by Charles Hull. He termed this as stereolithography in 1986. Shortly after, Scott Crump created fused deposition modeling, a different type of 3D printing in 1989. These two great people invented the most common methods of 3D printing that are available today. As I have said, there are a lot of types of 3D printing. Stereolithography, for instance, uses resin that is cured layer by layer using UV lights. Fused deposition modeling uses the moving arm to deposit molten layer of plastic to create a 3D model. Selective laser sintering, or SLS, is quite a bit like SLA. However, it uses laser and powder instead of resin and UV. The next three types of 3D printing, among many others, are more commonly seen in the industrial area where due to its high cost. So medicine has actually adapted 3D printing early on, as we can use 3D printing to create anatomical models which are case specific. So unlike mass-produced anatomical models, we are able to create these models that are normal or with pathology. They can be made multicolor or multi-material depending on the type of 3D printers that we have. So here we can see a picture of a 3D printed temporal bone. This is the bone of the ear, which we use to practice our surgeries on. Another use is the creation of custom templates, such as drills and cutting guides. So these are the things that could help us during our surgery. On the more advanced side of things, 3D printing has been used to create biocompatible implants such as tissue and body parts. So here we can see a 3D printed bionic ear, a bladder, and even a heart valve. With that being said, where are we now? More specifically, where is our hospital at? So allow me to present to you a case which we did a few years back. This is a 46-year-old male with a 4-year history of a slow-growing mandibular mass. This patient had a multicystic ameloblastoma of the mandible, or a tumor that needed to be removed. With the size of the tumor of the patient, removing this would leave a significant defect that would make the patient unable to function. So what we did was we reconstructed the patient's jaw or mandible and 3D printed the reconstructed version of it and used it to pre-bend our titanium implant. We then removed the tumor. So this is the picture intraoperatively, and placed our pre-bent titanium plate. Here is the picture of the patient before and after. So the patient was able to retain his oral function and was able to eat with minimal to no problems. The patient is still awaiting a second surgery to implant a bone from a different part of his body. Another case is a 9-year-old female with a 2-month history of rapidly enlarging oral cavity mass. This was an aggressive type of tumor, which we had to reconstruct. We used 3D planning to help us decide on the type of surgery for this patient. So we printed out the mandible of the patient where we measured how much we have to remove and created surgical cutting guides to help us during the excision of this tumor. However, this patient's tumor, which was initially a benign tumor, turned out to be malignant, and we have not yet started reconstructing the patient. So this would more likely require another set of planning. So this is what we also do in our department. We create surgical models for simulation. So this is a 3D printed temporal bone, or the bone of the ear. We practice our surgeries on this. Traditionally, this is done on cadavers. However, since cadavers are hard to obtain, we opted to use a 3D printed version. Although it does not replace a cadaver dissection, it can augment for the practice of doing a mastectomy. Another function that we have found very easy to create and use is the creation of nasal splints. We use the innate property of polylactic acid. As everyone knows, when polylactic acid is exposed to heat, it bends. So we were able to create a customized nasal splint, which compared to its commercial model or commercial nasal splint, it costs about 100 pesos compared to the commercial one, which is 300 pesos. We have also recently published a paper in the Philippine Journal of Otorhinolaryngology, Head and Neck Surgery, for the use of commercially available non-medical grade USB cameras for our ENT patients. So what we do is we use USB cameras to examine patients during the COVID pandemic. We 3D printed a handle that would help the patients use the said endoscopes. So here is how we are set up. We can see the patient's oral cavity, ear, and nose safely separated by a 1-meter distance and a clear plastic barrier. We can use this to examine the ears, the nose, and the oral cavity. Here are a few pictures that were taken during the examination. So this greatly helped us during our outpatient department during the time of COVID. So we have an upgraded version of this, which we call off-VEX or off-site virtual examination. So this time we 3D printed an ergonomic handle that would help the patients utilize the USB camera without having to worry about the orientation. So it's more of a plug and play thing. The handle can be outfitted with a tongue depressor that would help the patient examine their oral cavity without having to change endoscopes. So here is the toolkit guide. So how to examine the ear, the nose, and the throat using the same endoscope. Of course, disinfected in between uses. And here is one of my juniors checking a patient during a Zoom phone call where we instruct the patient how to use the diagnostic tool. So we are a relatively small makerspace and we are just starting. We have a few 3D printers. We have a single extruder FDM and a dual extruder FDM, and we have recently added a stereolithography 3D printer, which would help us more in creating more medical applications for 3D printing. So the department aims to acquire higher-end 3D printers that are capable of 3D printing titanium or PEEK implants that could be used for our patients. 3D printing has been pivotal to the department's rise, as the department believes that no two individuals are alike. Hence, the ability of 3D printing to create custom guides is paramount to the success of the patient's treatment. Here are my references, and muchísimas gracias.